My name is Hayley Miller, and I am a physician in internal medicine, diabetes, and metabolism at the Sandy Clinic. I've wanted to be a doctor for all of my life. I find that many people, if they don't know me before or when they're meeting me, are surprised I'm from Wyoming, from a small town. My dad runs the funeral home and the ambulance and is the coroner in my hometown. I always wanted to learn how to prevent people from ending up at my dad's place. And so he always was kind of surrounded by medical things. And so I grew up knowing that I wanted to do medicine. But then in March of my 5th grade year, I was diagnosed with diabetes. I share that with patients, and I'll tell them, yes, I know this is a struggle. This is a challenge that I have as well. And that led me to want to be an endocrinologist or diabetologist for as many years as I can remember. It's tough because a person with diabetes lives with it every single minute of every single day. Every single step that people take to manage their diabetes can make a huge difference. And so even if you have a blood sugar number that's high one day, the next number, if it's lower, is a success. And there's no one's perfect. Everyone with diabetes will have a blood sugar that's too high. Everyone will. That's what diabetes is. But if I can relate to patients on a personal level and let them know, yeah, I know it's tough. And I wouldn't give a patient a recommendation that I couldn't do personally, just because I know because I spent so much time working on diabetes that I have gone through all the different things. And if it's really impossible, I don't want to fault the patient for not being able to follow it. Then I can spend more time getting to know the patients and really being able to understand what needs to be done to make things better for them. I talk a lot about diabetes. I also take care of patients with all other kinds of metabolic conditions. I'm board certified in internal medicine, and so for patients who come to me with any of the different problems, diabetes, thyroid, whatnot, I can serve as their primary care as well as the specialist. For the patients who already have a primary care physician, then I can serve in a consultative role and work together with their primary care physician in taking care of them. And so I can provide both services to people. I personally believe that having a close relationship with your patient and actually caring makes it a lot easier to take better care of them. There is very rarely a day where I'm not glad and don't feel just happy that this is what I chose to do.